Worldwide, there are now 10.1 million cases with more than 500,000 deaths. In the U.S., hotspots continue to pop up in Texas, Arizona, and Florida. And across the country, more than 2.5 million people have tested positive for COVID-19 reportedly. And meanwhile, Vice President Mike Pence has now canceled events in Arizona and Florida that were scheduled for this week. And one hotly debated issue is, of course, the efficacy of face masks. Here to break it all down for us is Dr. Dara Kass, Yahoo medical contributor and Columbia University associate professor of emergency medicine. Dr. Kass, always good to see you. This morning, crossing the wires, Gilead came out with the pricing for their Remdesivir treatment for COVID-19. I think the pricing has a lot of people riled up on social media, more than $2,300. What's your take?
So they priced it based on the idea that it actually only saves hospitalization time. It doesn't actually save lives yet. What they've shown is that you can reduce hospital stays by about 4 days, and they price that at about a $12,000 savings. So they priced the course of treatment against that proposed savings, which is about $2,300 for government agencies. But remember that the insurance companies are actually going to be paying a little bit more.
Doctor, Gilead CEO Daniel Day wrote in his open letter that this pricing allows global access. Does it? Because I don't know what he's talking about here, but that price, that's a high price point.
So I think it depends on how people choose to invest in this medication, and more importantly, what it does for the global market on hospitalization rates, decreasing hospitalization costs, and more importantly, the price, remember, will be different internationally. It will be different for generic. They've already licensed the opportunity for other companies to make the medication generic. And in fact, some companies may be able to make it for as little as $1 a dose. So this is not only the pricing for the Remdesivir from Gilead is one thing, but it may be available cheaper through other companies soon enough.
Hey, Dr. Jared Lickery here. I just wanted to ask you about the vaccine front. We saw a company, the stock shoot to, let's see, almost doubled, tripled last week. Vaxart is in the news. So what is it? What's going on that front?
So I think the vaccine market is moving very, very fast, but it's still very hypothetical. We know that Dr. Fauci even said that if we get a vaccine, it may not even bring us to herd immunity because people may not even take it, even if it's developed and safe and available. But that also requires that we need a vaccine that's going to be effective. And we don't even know if we're going to find one that's going to be 90 to 100% effective in the virus. We may find something that's only 2/3 to 3/4 effective. So I think although people are really optimistic about the vaccine market and the development, it's still a very long way away, and we need to figure out how to get forward moving without the vaccine just yet.
Yeah, Dr. Kass, very important you mentioned Dr. Fauci. He said at the Aspen Ideas Festival over the weekend that the U.S. is unlikely to develop herd immunity. What is herd immunity, and how do we ultimately get it?
So herd immunity has been thrown around a lot as the idea of a natural infection, even getting us to an immune state before a vaccine. And what it really means is that 70% of people are immune somehow, either through natural immunity, getting the virus and recovering, or a vaccine, which induces the antibodies and immunity. What Dr. Fauci was saying was that even if we had a vaccine, if we don't take it up or it's not very effective, then we won't even get to that 70% immunity, that 70% antibody presence. So I think that the issue we're talking about is that natural immunity, getting the virus and recovering, was maybe one way to get to a large scale immunity. The vaccine is another, but neither is really reliably predictable or even effective at this point.
And Doctor, I wanted to ask you about the reopening efforts, which are also turning into reclosing efforts. It seems like we're taking 2 steps forward. Are we taking 1 step back, or is it 2 steps back here?
So actually, one of the things that needed to be acknowledged when we opened anything was that we were always going to have to close something back up. Right? I think this was a lot of false hope and misinformation from the opening states to say that once something was opened, it was never going to have to be closed. And unfortunately, what we're seeing is that if things are opened without data or science, then we run the risk of closing them back up very quickly and maybe even for longer than the first time. There are doctors that now worry that the second wave of infections in states that opened after being closed may be even worse because people are not really interested in closing back down and may not even follow the recommendations of their state or even mask up, which we know is a great way to prevent infections from spreading even in an open economy.
Andy, I think you're on mute.
I'm sorry about that. I was on mute. Dr. Kass, I wanted to ask you from an investing standpoint, what you think is more important, companies that make therapeutics or companies that make vaccines?
So I think that it's going to come down to how it's compensated. And I think also the idea that therapeutics, there's a wider variety of options in therapeutics than there will be in vaccines. And more importantly, I think that when a vaccine comes out, there's going to be a global demand that it's available at as low or no cost as possible, because the globe, the planet will depend on it. So if I was personally looking, I would probably look more towards therapeutics. I also think that it gives people an option to choose therapeutics and options that they want to take, which probably from an investment perspective is probably a better move.
Dr. Kass, a lot of market pros and investing pros we've talked to the past week continue to focus on the number of deaths. And it's morbid, but we're not seeing a rise in the number of deaths. What's happening at the hospital level?
So I think that that's a rise in deaths yet. And I think this is another time when it's false hope or misinformation that people are leaning on when they're not looking at the full picture. We've already gone through this once, and we saw it in New York in real time, where our hospitalizations went up and our ICU capacity went up. And we were actually in lockdown when that happened. And then our death rate started to climb. Remember that patients that are in the ICU with coronavirus who do not make it can sometimes live for 14 or 21 days in the ICU before, unfortunately, they pass away. We're also seeing that the states that opened early are having a rise of asymptomatic transmission, and we're not necessarily catching all of those cases yet. I would say that in 2 or 3 weeks, we're going to unfortunately see a large rise of deaths in states that have opened and are seeing the increased number of cases. And it's going to really catch up when people are least expecting it. And unfortunately, if they're still open and they're not going back at all, then it's going to continue to spread for a much longer period of time.
All right, let's leave it there. Dr. Kass, always good to see you. And I'll give you a quick plug. Follow Dr. Kass on Twitter. She really puts out some very, very helpful and timely information. Thanks so much.
Thanks.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.